Hi, welcome to Classes webinar today. Thank you for having me here. I'm Boncheol Leo Goo from Seoul, Korea. We have different kind of processes when we are looking at our aging phases. The mostly prominent features coming from the periorbital area, but usually it just drilled down to the downside with the gravity. So when we are looking at the lower mandibles and the lower face part, you can see the differences with aging. But usually we are well aware of the aging of the face, but the hidden part, the most important hidden part is the neck and dorsum of the hands, which is not covered by the makeup. So today we will find out how we can treat the kind of neck wrinkles with the Ultraformer 3, with the new hand pieces and the new tips with a different precise skin depths. We have a different kind of aging neck process. So we have the ideal appearances with the sharp lines, with the mandibular lines, and the not sagging of the skin, no sagging of the skin, and the drooling of the submental fat and submental tissues. But usually, the skin laxity comes with the first differences in the jaw area, and we can see that the more prominent banding with the Platysma banding here, and with the prominent associated muscles here. So when the bone absorption happens with the low height position, it makes this kind of a drooling all the way around, which is very unfavorable appearance of the neck. So we have a different kind of volume scales for the neck, but the most important causes of the neck aging, the aged neck looking appearances are firstly with the losses of the volume, and secondly, increased skin laxity. So with this kind of the causes of neck aging, we will see much more aged looking faces and aged looking necks and all around the body. So how we can treat them? The firstly, we have to see that the anatomical consideration, mostly deeper part, the cartilages and the vein and the bone, usually it is drilled down accordingly, but it is not affecting that kind of appearance too much. But if you are just making the chances in between the deeper part of the skin, we can see this kind of wrinkle structures. We have this kind of folded skin and decreased the matrix proteins like collagens and like the chondroitin sulfate and other kind of the proteoglycans or matrix volume the supplements. So if you are going to reverse this kind of changes, how we can treat them? We can just use the hyperthermia lifting therapies using the high focus ultrasound, which is well known to give the focal point with the hyperthermia to make shrinkages and to make newer collagen genesis and the rearrangement of collagen bundles. We will make more the prominent kind of changes. I heard that my voice is a little bit small in volume. So if anybody feels my voice sounds a little bit less, please type in the chatting or please tell the host to correct them. Okay, and to give this kind of a process, we are using the wound healing process. We give the skin coagulation at certain point, and that will make a wound contraction using the collagen synthesis, and then we will make a collagen rearrangement, making the skin lifting effect. But if you are thinking about this kind of tissue temperatures, we will see that the deeper part, especially under the platysma muscles, we will have a different kind of approaches, and we will need a precise depth approaches, which is very suitable for the high-focus ultrasound. And there are many kinds of other approaches. You can use the chemodenervation using the buttocks, or you can use the soft tissue fillers for the mostly volume augmentation, or other kind of EBD energy-based devices. But I think that the high-focus ultrasound is the most important and most widely usable machines or devices we can use, because the other kind of chemical peels and the lasers, especially the fully ablative lasers and the laser resurfacing, is quite strong weapon. But they are, especially for the neck, we have a longer downtime. Sometimes it is not controllable, and sometimes it is the barrier for the comfortable treatment. So the high-focus ultrasound opened a new era of the neck rejuvenation because it makes a certain kind of changes for the precise depth and the precise effectiveness, but it has very shorter downtime compared to the other kind of methods. And the other good additives or other kind of a combination treatment can be available with the high-focus ultrasound is very convenient. There can be augmentation using the dermal pillars, or the chemodenervation using the botulinum toxins, or other directional augmentation with the threads or the lifting in a more direct ways. You can use all of them, but today we will use the hyaluronic acid, very basic pillars, and which will regenerate and reconstruct the tissues at the same time. Once again, we have a different kind of structures down to the wrinkles. We have a thin epidermis, and we have especially on the bottom of the wrinkles, we have a decreased contracting surface, other kind of volume supplements in the matrix. But hyaluronic acid is well known as a regenerative drug. Usually it induces TGF-beta signaling pathways. As a result, we can see that the increased collagen 1,3 from our tissues, and collagen 4 and 7 as anchoring proteins that maintains integrity between the epidermis and the dermis. And the contracting surface, heparan sulfate, proteoglycans, glycosaminoglycans, all the decreasing materials when we are aging that makes our skin contour and the textures irregular. So there are very few skin boosters or the other kind of the mesotherapy units or other kind of drugs that can increase all of them. But hyaluronic acid, as itself, it can make a regeneration, and its property is quite remarkable. And hyaluronic acid for the reconstruction, we already all know that it offers a scaffold for newly generated collagens in the fibroblast migration and endothelial proliferation, which is very important in the neoangiogenesis, that makes much more the preferred collagen bundle rearrangement or new arrangement for the better looking dermal conditions. And this kind of the hyaluronic acid and the high-focus ultrasound is good for the synergistic effect because it makes a synergistic effect with the increased tensile strength with the fibroblast, which is activated for making the newer, healthier the collagen bundles in the wound healing process that is provoked by the high-focus ultrasound. So, which is very good consequent treatment, and it compensates each other for the induction of the wound healing process in our ways, and also additive the enforcement for the wound healing processes. So my treatment algorithm for the neck wrinkle is shown in the picture. The first thing is, if the patient lost the fat or volume on the neck, because usually if the fat loss is coming, we have the consequent skin sagging, but not always. It depends on the patient age and the patient lifestyle and other kind of habits all around. So if the skin sagging is the combined, usually skin sagging makes the superficial, the looking a little bit much more rougher and irregular. So usually supraplatismal, the shallow depth tightening is very, very necessary. And infraplatismal augmentation using the other kind of fillers or the much more dispersing, the volume augmentation is also important. Usually we use a lot of the augmenting the medical devices or other kind of materials which compensate the fat loss. But if there is no skin sagging with just the fat loss, usually in the young age or younger age patients, usually the skin sagging, if it is not, usually if the diet control is too heavy, too strong, and other kind of fat losses coming from the inside, usually infraplatismal augmentation can be necessary. But the infraplatismal tightening is also important because the superficial sagging is not so prominent. If the infraplatismal fat loss is not observed, if the patient is very chubby, or if the patient has a lot of fat tissue inside, firstly, we have to consider the fat reduction first, because if the fat is bulging out with a low hyoid, usually the lipolysis should be first, because we cannot remove that with just the skin tightening or the dermal tightening. But if the patient is just slim and if there is no fatty tissues, the less fatty tissues in the skin, usually the supraplatismal tightening is also important, because in these cases, usually the skin is folded, and if the skin is folded like this, the epidermis is getting thinner and thinner and thinner. So it is just like if we are folding the papers over and over and over, the structure is different. So usually in the cases, we are going to the supraplatismal tightening and the supraplatismal augmentation, which is very shallow injections or other things. That's my algorithm. So you can see that this kind of a thing from which volume is important, if the volume is important, or if the sagging is important. So you can just get some help from these kind of algorithms. And we will use the MF2 neck treatment today using the right depth in the 2 millimeter, because why we are using these 2 millimeter skin depths for the treatment is usually most of the epidermal and dermal thickness, and it is just upon the 2 millimeter or including all the red ridges, all the papillary dermis, it is not exceeding 2 millimeters usually. So we have a very, very low risk for making the PIH or other kind of the immediate side effects. And also we can target the supraplatismal, the spaces with very precise depths. And all of you know that if there is some of the fatty tissues in between platysma and the skin, usually we can just fold the tissues, and we can measure how we choose the different kind of treatment depths. It is not so difficult to choose. And usually we are treating two depths, supraplatismal and the infraplatismal. So it depends on the anatomical positions, but usually upon the skin thickness according to the skin condition, including the other kind of affecting factors like aging or something. So we can just go from because the margins of platysmal insertion and the origins are from the clavicles and to the mandibular lines. So we can just go through this way all around. And you can add, if there is some of the wrinkles, like usually these kind of directions, maybe we can add some of the Platysma treatment if it is necessary. Usually we have a very, very typical post-treatment cares, like if we have a side effects like clinical signs like reddish color changes or swelling, usually the waiting is just enough, and there are kind of very, very rare, the rare occurring blood vessel problems. Maybe we can just keep the cold pressures, cold compressions, but usually it just decreases in hours or just a couple of days. And other kind of a serious kind of side effects is not so the frequently happening. So you can just, I think everybody will know about this kind of post-treatment care protocols. So we will move on to the live MF2 combination treatment. So we will have a very, very short break and we will come back. Thank you. Okay, we have a beautiful lady here today. She is struggling with the just unwanted neck wrinkles, the transversing from the left to the right. In the front, we have big groups. Usually, it comes with the drooling of the older skin downward. And 힘 잠깐만 줘보시겠어요? 아까 할 때처럼. So, if she is making a contraction of the Platysma muscle, you can see that the prominent lateral side wrinkles. So, 힘 다 안아주셔도 괜찮아요. 고맙습니다. So, we will just move on to make a tightening for the Supraplative the spaces with the MF2 tips here. And if she has a very, very moderate kind of fat volume inside, so I think we can just add some of the additional steps for these wrinkles, but it depends because she has a different kind of skin thickness here and here. So let's find out which can be much more helpful to her skin. So we will use this MF2 tip. You can see that the very sharp and insertion point here, which is making the arrangement of the coagulation spots here. And it is very good because if the portion, contact portion of the tip that's wide, we can check. And this one is kind of a three-dimensional position. So if it is too wide here, maybe sometimes we can feel a little bit uncomfortable when we are making the full contact here. So we will go on to this waist first, and this waist part, secondly, and the third here covered with this area. So we will make 4 lines for each part, and we will move on to these. 하면 되는데 바로. 네. Firstly, we will apply some gels here. 불편하지 않으시죠? 좋아요. Usually we start from the mandibular lines and then to the segmental spaces and then go to the neck, to the clavicle area. 네, 감사합니다. You can see if the patient feels a little bit uncomfortable when we are treating the bony regions, sometimes we can move the skin like this to avoid the mandibular angles. 시작할게요. 괜찮으신가요? The working speed is quite fast, but the important thing is if you are making contact not in this direction to the ground or to the sky, where you can see that the fluid inside is not sufficiently covering the transducer. So you can just keep it down here, and you can move a little bit gently to make a contact firmly to the downward. And if the skin is getting pulled down to the clavicle, sometimes if you just push down like this, so you use the left fingers as a guide to the opposite direction. This way. So we finished the lines here. 괜찮으시죠? 네. If you have any questions or comments, please leave them in the chatting windows. We can collect them, and we will make answers for every question and comments. And all the questions and comments will be appreciated. Usually the platysma muscle is divided on the tip of the chin in a little bit oblique kind of directions, but usually you don't need to divide treatment area to the left or to the right, because this one is covering all the neck with a adjacent to the fibrous tissues with the supraplatysma or the infra spaces. So you can just move on to the whole area coverage with the first treatment. Which is quite fast. You can see that the almost half of the coverage area is already finished. If the patient's the skin sagging is too prominent, maybe you can add the 1 or 2 passes more to make a better effect for the supraplatysma tightening. But usually it is just necessary for the 1 passes for the basic kind of reaction. So we will just finish with the 1 passes first, and then check all the ways to make a after making the expression, facial expression, or the neck expression using the platysma muscles. Okay, great. Because the patient skin is very, very thin, usually the immediate swelling from the inside can block the prominence of the wrinkles. So in such of the cases, we can just ask the patient to contract the platysma muscles once again. 한번 다시 한번 표정 한번 지어보시겠어요? 목에 힘 주시고 그렇게 당기지 않으셔도 되고. I'm not asking her to fold the chin, pull the chin, but just make a contraction. 이 목을 이쪽으로 끌어내린다고 생각하시고, 징그러운 거 하실 때 있잖아요. 징그러울 때. 그쵸. To make when you see that some of the gross things, you can just the expression with so that's enough. And you can see the hold coverage is almost done, but lateral side, I need to add one of the passes. 거기 조금만 돌려보실게요. 네. When we are approaching the SCM muscles, you can just divide the neck area with this front and the rear. Usually we have the running kind of band is here. Using the SCM band with the ultrasound treatment to correct them is very, very hard. So if the prominence of the SCM muscles is too hard, maybe you can add some of the botulinum toxin treatment or other kind of combination will be very, very helpful. We can just add one or two. In this area, you can see that this kind of oblique lines all the way through the mastoid. It's quite fast and easy. 반대쪽 한번 볼게요. 감사합니다. 이쪽도 젤 한 번만. 예. Okay. 네, 감사합니다. 됐어요. 괜찮습니다. 요거 한번 닦아주시겠어요? 그 수압으로 한 번만 닦아주십시오. And we will remove the gels here, and we will move on to the injection of the hyaluronic acid. Usually, I use the non-cross-linked hyaluronic acid and very gentle and the soft, the cross-linked hyaluronic acid together, because if they're using the not if you're using the only the non-cross-linked hyaluronic acid all the way, usually it is the immediate action is quite good, but longer lasting result it cannot be expected. So you are using the augmentation little bit down under with the dispersing area with the more volumes, with the more softer the fillers. But if you are using the very well low G prime numbers fillers on the supraplatisma band area, is quite good for making the good the appearance after the treatment. So we will check the large groups here. 괜찮아요. We are making the down under the groups. Sometimes we have deeper groups on the clavicular lines. And 힘 한번 다시 한번 줘 보시겠어요? 한번 해보시고. 네. When we are giving the pressure down here with the contracture of the Platysma muscles, usually it is not visible when the neck is relaxed. So we will move on to this lateral part with the lower the infra platysma augmentation, and the supraplatisma augmentation we will use the much more the direct to the very shallow with the injection. We are using 3 tools with a. This is one example of the non-cross-linked the hyaluronic acid, and this one is a one example for the very gentle, the soft fillers with the cross-linked. And usually sometimes we use the very small size of the insulin syringes to make the spot by spot or the bead by bead injections. So we will prepare some of these fillers and we will move on to this. 이거를 여기를 하시고 됐어요. 이런 식으로 뒤를 열어서 그냥 하나만 더 넣어주시면 돼요. So if the patient, if you just fall down, pinch a little bit, you can see this pinching is always indicating the grooves inside. So it is just with the bezels up, we can just move on to these grooves. 따끔할게요. Like dispersing this small volume of the very gentle, soft, cross-linked, the fillers to here. Usually the fillers to the lip or the infra-orbital area is just enough for the strengths. And it will make a very good effect for the regeneration for weakened dermal-epidermal junctions or supraplatismal areas. Usually we call the papillary dermis areas or depths, like here. 괜찮으시죠? Usually you will see that the continuous injection of this kind of bead-like arrows, it will disperse just in hours. So usually you can just add some of the things, some of the fillers here, just underneath the epidermis. You will see how much you injected the fillers from your bare eyes, because we can see this one. And usually we don't give the filler injection before we treat with a Hifu or other kind of energy-based devices. And usually this kind of supraplatismal injections doesn't make the continuous bleeding. So it's a spot bleeding, and swap 하나만 주시면. If you just push it down like this, it's not maintained with the bleeding. So it is very easy to do. All you need to do is make a bezel up and give the consequent, very gentle subepidermal injections to the groove. Like this. And if you are getting too deep for these injections, sometimes you can touch the platysma. And if you are making some of the damaged platysma, usually it doesn't affect the effectiveness, but the patient will have a little bit more bleeding and a little bit more purpures after the treatment. So it is naturally gone, and usually it doesn't make any kind of complications, but it is it affects the downtime. So please be careful when you are treating superficially. we are using the almost the 0.5 millimeter for the whole neck area. But I think you will need a little bit more. Usually this kind of the fillers will disperse completely in a couple of the days, and it will be degraded in 3 weeks to 5 weeks. So usually it is just not making any kind of augmentation effect at this level or at these steps. But if you are treating the non-sagging, non-sagged skins or the other the Platysma augmentation, if you need it, you can just add some of the other kind of approaches. 다 됐고, 감사합니다. And then we will move on to the other kind of injections here. 조심하시고. 이거 아니요 그 cannulas. This one is a non-cross-linked hyaluronic acid, which will give the temporary augmentation for deeper area. You can use this direction to the lateral side of the induced neck wrinkles, or you can just keep the parallel direction to the neck area, but the neck wrinkles. But you can just add some of the things. 고개 조금만 돌려주시고, according to the parallel to the SCM muscles, you can just give the short puncture here. The infra platysmal spaces, and then 닦아주시고요. 조금 보여주시고 핀 좀 주세요. 조금 따끔할 수 있어요. 괜찮으시죠? Sorry, but we need to change the cannula here. 저기 밑에 하나 더 있어요, 가방에. 아니요, 봉투에 있는데. 여기 있다. 감사합니다. I'm using the 30 gauge very thin cannula here. So if the patient neck is quite fibrous, it is not always easy to make a penetration suitably. But the puncture site is quite fibrous here. Okay then. No. 괜찮아요. Okay. You can just use this kind of moving forward and back and giving the small volume of the non-cross-linked, the hyaluronic acid here. Okay, thank you for watching the lecture and the live session. So from now on, we will have the question and answers. So you can just type any kind of questions or comments to the chatting space. We will answer the question by question. Usually the wound healing process is happening right after the hypo treatment. So if you are have the same session or same place to have additional filler treatment, you can just after any EBDs, any energy-based devices. So today we use the filler right after the Hifu treatment, and you can use them. If you are asking the other places can be treated with the fillers after the treatment or EVDs, anytime you can just do that. And the question is, and next question is, what is the interval if we combine filler, thread, and the Ultraformer all together? Usually, if you are dividing the treating depths, you can use the EVD first, and then injectables later, just consequently, just turn by turn. But if you have the very intensive kind of treatment using causing a lot of swellings, maybe you can have some gap in between the treatment, even just the small number of hours. So I recommend if you want to give it them on the same day, maybe you can just add it with 1 or 2 hours intervals, but it depends. So you can usually you can just go it just turn by turn. And next question is it necessary to apply anesthesia with MF2 or not? And also, is it okay to do the pulses over the trachea? Usually, MF2 is not reachable to the trachea, so you don't need to worry about that. If you push hard to the dip, maybe you can affect them, but with the pressure, but not by the Hifu. So you don't need to worry about that. And usually MF2 gives the very just a tingling and some of the sharp kind of characters to the treatment to the skin. So usually we need very short time of the anesthesia, but with just a local anesthesia with the topical creams, that's just enough. But it depends on how much the pain, how much the patient can handle the pain. So, yeah. And next question is, can the treatment be done on the thyroid area? If the patient is very skinny and very sagged skin, you need to have the history taking whether the patient has goiter or not. But usually it cannot be usually cannot affect the thyroid depths. Usually it is covered with the fibrous tissue. So usually it is not necessary to cover the thyroid from that, but always the safety first, so you can just to make sure if the patient has thyroid problems, especially the goiters. Next question is almost similar. With the question is, do you also treat thyroid gland with the MF2? How about other cartilages? And also, will you treat the people that had cancer or thyroid gland before? Usually, I treat a lot of thyroid cancer operation, post-operation scar treatment. So usually it doesn't impact the kind of depths to the thyroid, but if the patient has some of the problems after the operation, if the active scar, if the active thyroid cancer, the treatment, the cosmetic treatment is not a matter. You need to treat the cancer first. But if the patient has a cancer history, and if the patient has the scar after the surgeries, maybe you can check the scar area first. And if it is hyperactive, or if it is hypertrophic, you can just avoid the scar area. But the other area is quite okay. And the next question is for the neck. Don't you need any design before the treatment? Usually we need to cover all the platysma area, so you don't need to make a designs or something. But if the patient has the neck wrinkles in specified areas, when she or he has a contraction of the platysma muscle and a very prominent kind of wrinkles, maybe you can just target them with the markings. So maybe you can add some of the markings, but usually we need the very specific designs. You can just cover all the platysma area. And next question is, can you give the lipolytic injections and Hifu in the same session? Very interesting question because nobody knows. Usually the almost all of the lipolytic solutions using the inflammatory processes will cause inflammation after the treatment or after the injection. So when the hypertreatment is quite enormous and very strong, maybe the patient's downtime can be longer. But it is still injectable, so if you want to combine at the same time, at the same day, maybe you can add some of them, but you can do it. It is not contraindication, but you need to take care of the patient with whether it happens with the unwanted swelling more and unwanted kind of downtime longer. I think the aftercare will be very important for that. The next question is what like our filler injection after? Soft filler like a skin booster or what? Usually I use the very small G prime number, the soft fillers, like for example, Restylane, the Kiss, or other kind of very soft fillers, or when you're using when you usually use for the periorbital areas or the lips, it is just enough. For the non-cross-linked, the hyaluronic acid, we can use mixed. We can use both of them mixed together for all the deficits together, or we can just divide them into superficial area and the deeper area. So the first thing is it really just disperse away, and you will just disperse, not making the direct correction of the wrinkles. So it will make a much more booster-like effect, but usually I don't use the skin boosters for all the neck wrinkle area. Maybe you can use as additive for the superficial irregularity. Maybe you can use the different kind of injection techniques, but injection or the permeation enhancement techniques. But usually we just use Platysma, the augmentation or the correction. The next question is, how do we identify the double chin with adipose tissue compared to the double chin due to the laxity of the skin? Very important question, because we don't have, all of us don't have the ultrasound with high resolution. We don't have. So usually, if the patient's BMI is quite the overweight or the higher, maybe you can expect the fat tissue inside the volume will be just more than the slender people. But that's the assumption. So you can just pinch of them when the patient has not like this spine position, but if you're with a neck extension, if the pinch with some of your fingers or the pinching scales, usually it is very, very different. If you are pinching in various surfaces, usually the skin is well stretched down like this. It is a sagging of the skin. But if you pinch deeper, the fatty tissues is deep. Pinches like a hump. But if the sagged skin is just a skin laxity induced the drooling, you can just pinch the skin, stretch it all over around. So it is very easy, but you don't have the discrimination when you have a supine position of the patient. You need to relax down with the lie down on the bed, and we can extend the neck through the way, all the way, and you can just pinch them. It's very easy to do. And next question is, could you please send or show your treatment scheme for the necklines once again? Can you show the pictures first? Yep. The scheme algorithm scheme, I think it is. Yep.
PPT 중에
Maybe you are talking about this scheme or the algorithms. You can capture or whatever. So once again, with the infra-platysmal fat loss, if it is or not, and if the skin sagging combined or not, and if the patient is chubby or not, is quite important, dividing the points. The next question is, can we combine the 4 depths together in one session? And how many shots is recommended to use for the full face and the neck? Usually, if the patient is very, very old patient and a little bit overweight and sagged skin altogether, maybe we can use all of the depths together, but it is very rare because when those kind of cases, usually treating the mandibular lines and the submental area covers usually the origin of the platysmal area here on the mandibular lines partially. And for the neck areas, it is very rare to use all of the 4.5 millimeter skin depths or the treatment because of the anatomical the positions. But usually we use the mass muscle extension here for the 4.5, but to the neck area, starting with the adhesion muscles to the clavicles, usually we just use a MF2 mostly, and sometimes 3 millimeters, but it's very limited. Next question, I think it is the last question of today, and the question is, will ultrasound and injectable treatment promise longer-lasting result versus hyaluron? Yeah, definitely, because I explained why the hyaluronic acid is important for the neck area, because neck has very thin skin, and the thinner changes skin with the folding and other kind of changes. So if you are using the only ultra-focused sound, you will need multiple sessions, and sometimes you will need the dynamic wrinkle combined conditions. It is not always satisfactory for the single treatment modality. So usually we use a lot of things with the sometimes we use the PD threads, sometimes we use the other kind of injectables, like other injectables like a PDLA or other collagen boosters. But hyaluronic acid is very intuitive, and it is very good to use and very controllable from our hands. So I prefer for the neck and the dorsum of the hands, but usually, yeah, it lasts longer than the ultra-focused down treatment only. And also, the combination treatment, it exceeds the maintenance when the hyaluronic acid injection only. So it's very obvious. We have several questions more listed. The question is, if we have the fat in the subcutaneous fat layer in the neck, can we start with the 6 millimeter? Personally, I didn't use the 6 millimeter on the neck ever, but if the patient is very, very heavy and very, very chubby with a lot of the endocrinologic problems, maybe you can use. But be careful when you are treating with enough space can be secured when you're treating the hypo. It's very important when you are treating lower part of the neck, especially. And the next question is, how long after the filler can Hifu be made? Well, usually these filler injections last only 3 weeks. Yeah, usually the kind of low G prime number fillers, it doesn't last longer. So usually you can just add the normal treatment intervals with the Hifu more than 3 weeks. I think it's just enough. The next question is, what kind of treatment would you use to do the infra-platysmal tightening? Yeah, very important questions. Usually we use the high focus ultrasound a little bit deeper. I mentioned the 3 millimeters, but if you can add some of the radio frequency, maybe you can use, or other kind of the treatment with the how can I say that, the bulk heating of by the long pulse lasers, maybe you can use. Next question is, and if we don't have fatty tissue on our chin, can we start straight with 4.5? Personally, I don't recommend it, because if you are using the 4.5, the not on the mandibles and then not upon the hyoid bone, maybe you can try very small areas with the drooling when the hyoid bone is lower. But it's very limited use, so be careful. Okay, thank you for all the questions, comments, and thank you for your precious time to joining this webinar. And I hope that this will help you a lot in your practice. Oh, last questions we have. Does the 4.5 cartridge act on the adipose tissue or on SMAS? Not here. Maybe you can use it here, and for the extension of this excision muscle here, maybe you can use. Thank you for listening, and thank you for attending. I hope you have enjoyed this webinar. Thank you.